Good morning to our media partners and those watching on DOH social media channels po. Welcome to today's Media Forum, Friday, December 3. So before we start our Media Forum, may I call on Yusek Maria Rosario Singh Berhere for a short briefer po on the Omicron variant. Good morning po, Yusek.
Yes, good morning, Jolo, at magandang umaga po sa inyo lahat. Welcome to our Friday's Media Forum. Since we have been receiving a lot of questions about the Omicron variant, we are going to give you a brief situationer of what we have as information right now. For the other questions, we are still trying to consolidate our answers and coordinate with the concerned national agencies. So next slide, please. So based on the GSAID submissions, next slide. Based on the GSAID submissions, South Africa has reported 183 cases. Parang iba. Yung slide deck. Again. Okay. Previous slide, please. Sorry. So bago po tayo magsimula, nais po muna namin bigyang pagpasalamat ang mga nakilahok sa ating National Vaccination Days, lalo na po sa mga volunteers, sa mga doktor, sa mga healthcare workers, registration and data management volunteers, private sector and non-government sectors, ang ating mga local governments, ang mga local vaccination sites at sa lahat po na naglaan ng kanilang oras upang matulungan ang ating gobyerno dito sa malawakang bakunahan na ito. Maraming salamat po sa inyong lahat. Nakita po natin ang diwa ng bayanihan sa dami ng nakiisa upang makapagbigay ng bakuna sa higit na 7 milyong katao. Sa pagsisimula po ng pagbibigay ng booster or additional doses sa lahat ng adult population, nais pa rin po namin bigyang diin ang kahalagahan ng pagbibigay ng bakuna sa mga hindi pa nababakunahan para mabigyan din sila ng proteksyon laban sa severe COVID-19 na nagdudulot ng pagkakaospital at pagkakamatay. Pinapaalala din namin po na kahit kayo po ay fully vaccinated na, patuloy pa rin po tayo mag-ingat at sumunod sa minimum public health standards sa pamamagitan po ng inyong tamang pagsuot ng face mask, pagdidistansya sa ibang tao nang hindi bababa sa 1 metro, pagpapanatili ng maayos na daluyan ng hangin sa inyong silid, loob ng bahay or opisina, palagi ang pag-uugas ng kamay at pagdidisinfect ng high-touch surfaces at ang pag-iwas sa mga gawaing may 3 Cs, closed spaces, close contact settings at crowded places. Lagi po nating isasaalang-alang ang pagpili ng mga ligtas na gawain at magdiwang ng ligtas na Christmas ngayong papalapit na po ang holiday season. Now we move on to the updates on the Omicron variant. The first confirmed case of the B.1.1529 variant, now called the Omicron, was collected on November 9, 2021. It was first detected this November 2021 in Botswana, Hong Kong, and South Africa, and has since comprised 75 to 100% of sequenced cases in the Gauteng region of South Africa. Formerly designated as a variant under monitoring last November 24, it is now classified by the World Health Organization as a variant of concern as of November 26. We can see from the graph on the right that the Omicron, the blue area, is competing with the Delta, which is the red variant. Next. Early reports show that the Omicron variant has 50 mutations overall, of which 30 are in the spike region. Such mutations had been linked to increased transmissibility and immune evasion. However, further studies are necessary to better understand just how these mutations affect transmissibility and efficacy of the vaccine against the B.1.1529 variant. Next slide. As of December 3, there had been 340 submissions of genome sequences to GSAID that are positive with the Omicron variant. Of this, 172 were from South Africa. There are now 35 countries or jurisdictions that have reported detecting cases of Omicron either at their ports of entry or locally. For the following slides, we will provide updates from countries identified with local transmission of the Omicron variant. Based on GSAID's submission, South Africa has reported 183 cases so far. Reports state that this is 75% of the total sequenced in the country for the month of November. Botswana has confirmed the presence of 19 cases at present, 16 of whom are said to be asymptomatic. Additionally, 14 out of the 19 cases are foreign nationals. Belgium has now reported 2 confirmed cases. The first is of an unvaccinated individual who has had a travel history to Egypt through Turkey and has household members who had tested positive for RT-PCR. The second case is still under investigation, but early reports state that it is not linked to the first case. Italy's first case was of an individual who returned from Mozambique. 5 of the individual's family members also tested positive for the virus. It is being investigated whether they had been infected with a new variant as well. However, 5 additional cases of the Omicron variant, all with links to the son of the first case, had been confirmed as well. South Africa, Botswana, Belgium, and Italy were temporarily escalated to the red list in IATF Resolution 151-A. The Netherlands, which was included in the red list as well as in the recent resolution due to its steep rise in cases, has found 14 among the 61 positive cases in a flight from South Africa to be positive for the Omicron variant. Other samples are still under review. Additionally, they report 2 additional cases of samples taken between November 19 to 23 before South Africa announced its presence. It is still unclear whether these 2 individuals had traveled to South Africa. The Netherlands has met case and test metrics for red list due to a very high risk case classification and a steep case increase. In the United Kingdom, 13 cases had been found in England, one of which had already left the UK upon detection. Additionally, 2 positive cases in Israel were doctors who had returned from London. 9 cases were reported in Scotland, where not all had travel history to South Africa. Community transmission is suspected by their health officials, and the UK met the yellow list metrics. In Portugal, 13 cases of the new variant emerged related to a soccer game where 1 player had recently returned from South Africa. 44 players and staff members are in self-isolation at present as they await for the results of their repeat tests. Portugal is classified currently as a yellow country. Canada has reported 10 cases so far. 5 of these cases had been found to have travel history to Nigeria, while the other 2 are still under investigation. A case detected in Hong Kong was of a fully vaccinated individual who had come from Canada on November 10. The individual tested negative on November 12 and 14, but presented with symptoms on the 17th and reportedly tested positive the next day. We have classified Canada currently under the yellow listed countries. South Korea has recently detected 5 cases of the Omicron variant. The first 2 were of a fully vaccinated couple who had arrived from Nigeria. Being fully vaccinated, they were exempt from the country's post-travel quarantine. The individual who drove the couple home has also tested positive for the variant. At present, the sample collected from the couple's son, who has tested positive, is being sequenced. Family members of the individual who drove them home are also being tested. An unvaccinated couple who also had travel history to Nigeria have tested positive for the Omicron variant as well. South Korea is currently under the yellow listed countries. Nigeria has reported 3 confirmed cases at present. However, confirmed cases from Canada, South Korea, and Ghana have all reported travel history to Nigeria. With November 30 data, Nigeria falls under the metrics for green-listed countries. In Norway, an individual who had attended a company Christmas party has been found to be positive for the Omicron variant. 41 of the attendees have since tested positive for the virus, along with 9 individuals from neighboring municipalities. The country has since reimposed mask mandates and encouraged social distancing. The USA has also detected 3 cases of the variant. 1 case is of an individual who had attended a convention in New York. Upon returning to Minnesota, the individual presented with mild symptoms and sought COVID testing. The two confirmed cases are of individuals who has had travel history to South Africa, where one is presenting with mild symptoms. These two cases are unrelated. The CDC imposed the requirement of a pre-departure test taken within 24 hours prior to departure to strengthen their border control. Iceland has also reported 3 cases at present, among whom is a fully vaccinated individual with no recent travel history. The individual is currently in the hospital and is presenting with moderate symptoms. 4 more cases are currently under investigation. In Switzerland, which has been placed in the red-listed countries due to steep rise in cases, they have reported 3 cases at present. Of note is the case of a fully vaccinated student who has no reported travel activity and is presenting with mild symptoms. Around 100 classmates are currently in quarantine. The 2 remaining cases are linked where the unvaccinated individuals had returned from South Africa. For the updates on our country risk classification effective until December 15, as of date, the red-listed countries has a total of 14 countries: Botswana, Belgium, Eswatini, Italy, Lesotho, Mozambique, Namibia, South Africa, and Zimbabwe are placed under this list due to the threat of the recently discovered Omicron. We have also added Austria, Czech Republic, Hungary, Switzerland, and the Netherlands due to the steep rise in cases detected in these areas during the time of assessment. This shall be in effect until December 15. In an effort to tighten border control amidst the emergence of this new Omicron variant, the IATF has temporarily suspended quarantine protocols for green-listed countries as per IATF Resolution 151-A. Non-red-listed countries are to temporarily follow testing and quarantine protocols for yellow-listed countries. Meanwhile, travel is not allowed for countries in the red list, except for repatriated flights and those included in the IATF exemptions. All allowed arrivals shall undergo quarantine and testing protocols. Additionally, testing and quarantine protocols for yellow-listed countries had been extended. Fully vaccinated travelers are required to submit a pre-departure test taken within 72 hours prior to departure, along with facility-based quarantine with 5th-day testing. Completion of 14-day home quarantine is required upon the release of negative results. Unvaccinated individuals are to have the same pre-departure test requirements in addition to facility-based quarantine with 7th-day testing. Completion of 14-day quarantine is required as well once with negative test results. Lastly, we will provide some updates on the backtracing efforts that we are currently conducting for the red-listed countries. To start, let me share with you the latest guidelines in response to the Omicron variant. Based on IATF Resolution number 150-D, Bureau of Quarantine and local governments are to locate passengers from November 19 to 26 from red-listed country arrivals. They have to complete 14-day quarantine even with negative results. RT-PCR testing on the 7th day or upon location of the passenger, whichever is later with arrival as day 1 if they are not fully vaccinated. IATF Resolution number 151 states that BOQ, DILG, and LGUs to locate passengers from November 15 to 29. So this is a revision of the previous IATF resolution. So what we are going to implement right now would be IATF resolution number 151. They have to complete the 14-day home quarantine from arrival as day 1 and retest if with symptoms. Next slide, please. These were the 250 returning overseas Filipinos and 4 foreign national arrivals from the November 15 to 29, 2021 whose country of origin were from South Africa. BOQ has started to locate these passengers. No positive case was reported on retest, while the 3 foreign nationals from Region 6 tested negative on RT-PCR retest last December 1. The BOQ and the RESU has verified 71 cases, of which 68 are returning overseas Filipinos, and 3 are foreign nationals from Region 6. 70 are all in facility quarantine, including the 3 verified foreign nationals. 1 returning overseas Filipino is in home quarantine. For the last slide, the 3 South African nationals who arrived in Negros Occidental last November 25 and 26 are all fully vaccinated and are all currently asymptomatic. They are all undergoing quarantine in rented houses and have underwent re-swabbing last December 1 with pending test results. That's all. Over to you, Jolo.
Maraming salamat po, Yusek, for giving us the latest briefer on the Omicron variant. Now, let's go to the questions from our media partners po. For the first question, we'll be going to the question of Sofia Tomacruz of Rappler po. For her first question, why did the DOH decide to allow boosters for all fully vaccinated adults? Do we have enough supply to cover this need and reaching those who are still unvaccinated po?
Yes, Sophia, no, this was the amendment of the Emergency Use Authority coming from the Food and Drug Administration last November 29. So when they amend their EUA, this is based on global evidence and the evaluation was done also. And with this, pag tinignan po natin yung EUA na lumabas, even with the guidelines that were issued by the Department of Health, meron po tayong nilagay na prioritization pa rin. Ano? Na pagpa-prioritize pa rin tayo for those unvaccinated, for those for their second dose of vaccines. Pangatlo po, yung priorities natin for booster doses, who are the senior citizens, the immunocompromised, those with comorbids, at saka yung healthcare workers natin. And then when we have enough supply still, after all of these priorities, that's the time that we do our boosters. For now, we still are awaiting committed vaccine doses to be delivered to the country, and this is totaling to about 30 million still to be delivered to the country until the end of the year. So titignan ho natin, but based from our inventories sa ngayon, kumpleto po at kasya, no? Sufficient. We have sufficient supplies to cover both for the unvaccinated and also for the booster doses. We are not aiming to finish all booster doses for this year, no? So nakalaan po tayo na matatapos natin ang booster dosing natin hanggang second quarter of next year.
Thank you, Yusek. Another question from Sofia Tomacruz po. Will we still be following the HTAP's recommendation that 70% of total populations of hotspot regions and 50% of groups like A2 should have received 2 doses or 1 of J&J before opening the booster drive to the general population? In effect, has this been repeated with go signal to allow all adults to get?
We have to understand, Sophia, no? The Health Technology Assessment Council is an expert group which is recommendatory to the Department of Health. So whatever decisions that they make, it forms part of the consolidated recommendations coming from all of our experts. The Health Technology Assessment Council is charged or mandated to provide expert recommendations based on what government is going to procure. So when the Health Technology Assessment Council provided the recommendations for boosters, the recommendations were consolidated alongside with the other experts' recommendations. And after that, after having evaluated all of these experts' recommendations, nag-decide po ang Department of Health and Government on what to do. So base po dito sa meron tayo ngayon, binabase po natin ang ating mga booster dosing ayon sa Emergency Use Authority na ipinalabas naman po ng Food and Drug Administration.
Thank you, Yusek, for the clarification. Another question po from Sofia Tomacruz. What impact, if any, will the WHO SAGE's position on boosters for general population affect the DOH's rollout of boosters? If in the event SAGE does not endorse this, can the Philippines still be prioritized boosters po?
We all know that the SAGE completed recommendations will come out by December 7 or 8 when they are done, no, with their meeting, no, for this specific dates. So ang ano naman po natin, nilagay natin dyan sa EUA and the guidelines, yung priorities pa rin po ang atin pong susundin. The booster doses for 18 years old and above would be the list of our priorities dun po sa nakalista doon. So ibig sabihin ng guidelines na yan at ibig sabihin ng EUA, we still prioritize those unvaccinated, those to receive their second dose, at saka yung mga needing boosters talaga or third doses like immunocompromised and our senior citizens and healthcare workers. Now, if ever the SAGE recommendations will be out by December 7, and there would be additional recommendations within this document, and then we will be revising accordingly base dito sa SAGE recommendations.
Thank you, Yusek. For the last question of Sapieto Macruz, how much of a factor was Omicron in allowing all fully vaccinated adults to get a booster?
Actually, Sophia, even before the detection of this Omicron variant, nagpaplano na po ang Department of Health at saka ang ating IATF ng pagbibigay ng booster. Pinag-aaralan na. I think we started discussing this around July or August, no? So nag-umpisa na tayo with our experts on this at nagbigay na rin po ng mga initial recommendations and nag-final tayo ng recommendations natin, wala pang detection ng Omicron variant. So giving these boosters, hindi talaga directly related, no? This move for us to give the boosters. Giving these boosters would just want for the government, just wanting that there is better protection for the population. But of course, indirectly, this will affect, no? Na dahil may pumapasok na bagong variant at ang objective ng gobyerno ay magbigay ng karagdagang protection, nagkakaroon po tayo ng indirect effect on that. But let me just clarify that the government, together with their experts, had been discussing boosters already even prior to the detection of this Omicron variant.
Thank you, Yusek, for the clarification po. For the next question, it will come from Caroline Bonkin of CNN Philippines. Yusek Kabutay said DOH approved the extension of Pfizer's shelf life. May we get more details on this? May we also know what other brands are submitting a recommendation for the extension of the vaccine's shelf life?
Yes, no. So, Caroline, itong extension ng shelf life ng Pfizer, this happened months before. This was applied for by the manufacturer, submitted to the Department of Health and FDA, that they found, no, based on their continuing studies of their vaccines, that we can extend the shelf life up to another 3 months from the time that it is set to expire. So we were able to use up some the Pfizer doses na meron tayo na set to expire, na extend ng 3 months. And that is what we are expecting also. Tinitignan if the other vaccine manufacturers also can follow this suit and apply with FDA as well, based from their studies, if the shelf life for these specific vaccines can also be extended.
Thank you po, Yusef. From Sheila Crisostomo of the Philippine Star, aprobado na po ng Food and Drug Administration ang EUA ng Sputnik Light bilang booster shot para sa lahat ng bakuna versus COVID-19. Bakit hindi pa ito sinasama sa mga bakunang pwedeng gamitin natin sa ngayon bilang booster po?
Yes, Sheila, no? So, ang ating pagbo-booster or ang pagbibigay ng booster doses, this will be dependent on the supplies of the country. Sa ngayon po, wala naman po tayong ganoong supply ng Sputnik Light. Ang supplies po natin currently would be Pfizer, Moderna, Sinovac, and AstraZeneca. So kapag po nagkaroon na tayo ng sufficient supplies of this specific type of vaccines, that's the time that we may consider this being part of this dosing for boosters. But for now, because our supplies are not enough or we do not have the supply for this type of vaccine, hindi pa siya kasama dun sa options na meron tayo ngayon.
Thank you po, Yusek. From Aiko Miguel of UNTV, what lessons have we learned from the onslaught of Delta that can be applied and strengthened versus the Omicron variant po?
Well, Aiko, we have the four-door strategy. And we all know that this four-door strategy has worked for us during that time that Delta variant entered the country. Pag tinignan ho natin yung analysis, no, ng mga pagpasok ng mga variants sa ating bansa, kung kailan tumaas ang kaso, kung kailan siya na-detect, we were able to delay the entry of Delta variant here in the country for about a month bago tayo nagtaas na talaga ng kaso. So this is a very important lesson for all of us. We closed our borders early enough. We implemented strict protocols in our borders early enough, and we did our surveillance in the community and intensified our community response. So we were able to delay the onslaught of the Delta variant here in the country. And for us, dun sa mga nagawa natin before, ginagaya natin uli, no? Kung ano man yung nagawa nating maganda during the Delta variant, we like to adopt it again and make it better. Kaya nga ngayon pa lang po, tayo po ay nagsasara ng ating border sa mga piling countries na nakita natin na tumataas sa mga kaso base sa metrics. And also, nakita rin natin na pauna sila po yung mga nakapag-detect na ng variant na Omicron. And this would be, sa tingin natin, magiging epektibo rin para sa atin to further delay the entry of this Omicron variant. As to the communities naman, pagpasok nila, meron tayong appropriate quarantine protocols. We have revised our protocols to make it more appropriate para hindi rin tayo malusutan. And of course, second to that would be the community where we expect local governments to intensify our PDI-PR plus response. But what would be most important for all of us right now, comparing to the variant Delta and now this Omicron variant, during the time that Delta entered the country, our vaccination was not that high yet. Pero ngayon nakikita natin na tumataas na ng tumataas ang mga numero ng mga tao or Pilipino na nababakunahan. At sa tingin ko, this would be an additional protection for all of us when this Omicron variant enters the country.
Thank you, Yusek. Another question from Aiko Miguel. Have we sequenced enough to trace and check that there's no Omicron variant among the confirmed cases recorded in the country?
Oh, well, Aiko, no, we are doing our biosurveillance regularly. We are also doing backtracing, no, yung sinasabi natin, nagre-retrospective sampling din tayo. Pero as with the other countries, no country no in the world can do sequencing for all positive samples that comes in or be detected in their country. So ngayon, ang ginagawa natin, purposive pa rin tayo, pero lahat ng returning overseas Filipinos na magpa-positive, sinasubject natin yan sa genome sequencing. We will find out, and hopefully this strategy of ours, we can be able to immediately detect and determine kung naandito na nga ang Omicron. Pero ang isa lang gusto nating paalala sa lahat ng ating mga kababayan, na whether it be the Delta variant, the Omicron variant, whatever variant there is, kung naandito na, kung wala pa, kung tuloy-tuloy po nating ipapatupad ang ating mga protocols for safety, the minimum public health standards, and also yung ating po mga pinapatupad na mga protocols for our alert level system, and magpapabakuna tayo lahat, we can be able to surpass again another challenge if ever Omicron variant comes in the country.
Maraming salamat po, Yusek. We have several questions from the media regarding 14,000 doses of AstraZeneca that have exceeded their shelf life po. From Greg Gregorio, more than 14,000 doses of AstraZeneca jabs were reported to have expired in Negros Occidental. May we get the DOH reaction about this? Similar question with Lay Alves po and Job Manahan. Ano po ang nangyari? Bakit hindi nagamit ang halos 14,000 doses ng AstraZeneca vaccines sa Negros Occidental? May mananagot po ba?
Yes, no? So Greg, Lay, and Job, itong 14,000 na doses na to, nagsalita na rin naman yung local government. No? Sinabi nila that they were trying to distribute among their local governments, but unfortunately, ayaw tanggapin ng ibang LGUs nila yung mga bakuna na binibigay because it was near expiring. Itong 14,000 bakuna ng AstraZeneca. So ang ginawa ng ating gobyerno, kinuha natin, pinarantin muna natin, o tinago natin, we stored it with a defined storage guidelines para po magiging efficacious pa rin siya or epektibo pa rin siya kapag binigay kung sakasakali. So what we are doing right now, we have coordinated with the manufacturers, katulad ng sabi nga ng National Vaccine Operations Cluster, kinakausap kung magkakaroon din sila ng pag-a-apply ng extension of shelf life for these vaccines para magamit pa rin po even after this expiring date. So we will wait for that, but for now, these 14,000 doses are stored with a definite guideline on how we store it para hindi rin po further na masira ang mga bakuna. Kung ano ang nangyari during this time, according to the local government, based from what they have said, some of the local governments did not want to accept near expiring because they said baka hindi na epektibo. Yung ibang local governments nila may preference for a brand. Ayaw nila yung brand na ito. So ito po yung dalawang bagay apparently na nakita natin o nabasa natin na sinabi ng kanilang local governments. Nevertheless, of course, we are still further investigating. Tinitignan po natin kung ano po ang pwede pa nating mai-improve sa ating mga processes in the coming days and in the coming weeks. But gusto lang ho namin magpaalala, gusto lang ho namin makiusap sa ating mga local governments. Let us try to consider that these vaccines are very, very valuable. These are critical commodities at this time of the pandemic. Pag binigyan po namin kayo, hindi ho kami magbibigay sa inyo ng bakunang expired na. Ang binigay sa inyo, near expiring, which still can be used. Kahit ano pong gamot yan, kapag hindi pa tumatama doon sa expiry date, maaari pa rin po natin gamitin at magiging epektibo pa rin po yan. Pangalawa, yun pong mga supplies natin ng bakuna ngayon, kung ano po ang ma-deliver sa inyong lugar, sana po tanggapin po natin. Pare-pareho po ang epekto ng mga bakunang meron tayo ngayon. Whether it be the mRNA vaccines, yung ating bakuna ng AstraZeneca o yung Sinovac, pare-pareho po yung epektibo against severe infections and therefore preventing hospitalizations and deaths.
Thank you, Yusek, for the clarification po. From Leigh Alves of GMA News, ano po ang update sa genome sequencing sa recent arrivals? May mga nagpositibo ba sa COVID and recent travelers?
Yes, Leigh, no? So we are still processing the batch that we are going to subject to whole genome sequencing for this week. Results might be tonight or maybe tomorrow, no? Usually it's Friday or Saturday that we receive the results from the Philippine Genome Center. So as I've mentioned a while ago, kanina dun sa presentation, meron pong dumating na 253 from South Africa noong November 15 to 29. May 3 galing Burkina Faso and merong 541 galing sa Egypt. Each of these countries nagkaroon ng isang traveler who tested positive for COVID-19. So merong isa out of 253 from South Africa, isa out of 541 from Egypt, at isa out of 3 from Burkina Faso. So lahat po yung nag-positive na yan, as long as the city values are appropriate, ipapadala po natin sa Philippine Genome Center for whole genome sequencing.
Thank you po, Yusek. Another question from Leigh Alves po. Nakapag-expand na po ba ng genome sequencing capability sa Visayas at Mindanao?
Yes, no? So, Leigh, since the start that we have reported that there is this satellite offices or laboratories for the Philippine Genome Center in Visayas and Mindanao, nag-umpisa na lahat ng kailangan nating gawin. So nabuo na po ang ating pong mga healthcare workers ng Visayas and Mindanao PGC ay currently undergoing capacity building. They are training. Tapos na po sila mag-train on bioinformatics. Ngayong linggo po yata, there's another training for them. Inaantay din lang po natin dumating yung mga additional equipments nila, and according to Dr. Cynthia Saloma, dadating within this next 2 weeks. So isi-set up yan, magkakaroon po ng mga practice runs. So tinitignan po namin nung nag-meeting kami nung isang araw, baka first week of January na ho tayo makapag-umpisa dito sa ating mga satellite laboratories ng Philippine Genome Center sa Visayas and Mindanao.
Thank you, Yusek. From Rafael Bosano naman po of ABS-CBN. Given the numbers that we're seeing now, the swift actions to control the borders and efforts to ramp up vaccination vis-a-vis the available information on Omicron, how does the DOH see the country doing in case it enters the country? Will we still likely go back to recording numbers as high as we did during the Delta surge po?
Wag naman sana, Rafi, no? Pero hanggang sa ngayon, inaantay po natin yung ibibigay na further information base sa mga pag-aaral na ginagawa regarding the Omicron variant. And WHO has said that they can be able to release further information in about 1 to 2 weeks time para makapagbigay ng guidance sa mga bansa katulad natin na nag-aantay. Because we really need to know how transmissible this variant is, how infectious this variant is. Ito ba ay nakakapag-cause ng mas severe na infection? Ito ba ay nakakapag-cause ba talaga ng reinfections? Ito ba ay nakakaapekto sa ating mga bakuna? Itong lahat ng ito sa ngayon are uncertain. But what is good right now, it buys us time for our system to prepare so that when, if ever, that the Omicron variant enters our country, we are prepared. So Rafi, comparing with the months that the Delta variant came in the country, katulad ng sabi ko kanina, unang-una't napaka-importante, mas mataas na po ang mga bakunado ngayon dito sa ating bansa. And that, I believe, will work for the population dahil mas marami na po sa ating protektado. Pangalawa, handa na po ang ating mga ospital. Meron na po tayong mga standby, ng mga kama kung sakasakaling dumating man tayo, parang accordion nga ang katulad ng sabi natin, 'di ba? Nung nag-Delta variant tayo, tumaas ng husto ang kaso, nag-expand ng husto ang ating mga ospital. And that they can do already, and that has been tested already. Pangatlo, syempre, in-intensify na natin ang ating border controls. That is why we have classified other countries into this red list para makita po natin at hindi muna po natin ma-prevent pa natin further kung may makakapasok man with this Omicron variant. Also, we have revised our protocols for incoming travelers na kung saan hinabaan natin, ginawa nating 5 araw kapag bakunado, 7 araw kapag hindi bakunado ang testing nila, and they have to strictly follow home quarantine and be endorsed to the local governments for monitoring to complete the 14 days. So hopefully lahat ng ito dahil tayo po ay natuto na dun sa lesson na nagkaroon tayo nung nagkaroon tayo ng Delta variant, magawa po natin lahat uli mas better so that we can be able to prevent another spike in cases in the country.
Thank you, Yusek. Another question from Rafael Bosana po. Does the DOH recommend those planning to go home to the Philippines for the holidays to postpone their plans instead so as to further lessen the chances of importing Omicron? For those who will push through with plans of coming to the country, what should they prepare for?
Rafi, we cannot close our doors to the rest of the world out of fear. Kailangan handa tayo. Unang-una, kailangan natin i-considera mga kababayan po natin yung uuwi dito sa ating bayan sa darating na Kapaskuhan. Pupuntahan ng kanilang mga pamilya. Kaya po ingat na ingat din po ang IATF na magdesisyon kung paano po natin babalangkasin at makaklassify ang ating mga iba't ibang bansa kung ito ay red, yellow at saka green. Dahil gusto po natin i-considera din aside from the trends of cases, detection of Omicron, kung ano naman po yung magiging epekto rin para sa population natin. So we were able to identify based on science naman po itong mga metrics kung saan we can prevent specific countries na hindi makakapasok ang kanilang mga individuals or travelers from there, but we were able to still meron pa rin tayong mga yellow and green countries na maaari pa rin naman pong makauwi dito. So unang-unang prinsipyo, hindi po tayo magsasara and to isolate Philippines sa rest of the world. Pangalawa po, kailangan din natin isipin na the threat is there, but if we are prepared, katulad ng lagi nating sinasabi, bakunado tayo, we follow protocols, and then we can be assured that we will be protected. So yun lang po, kailangan lang they prepare when they get here. Please be vaccinated kapag uuwi na po kayo. You expect that you will be quarantined, and you expect that you will be monitored by your local governments until 14th day in your house or in your homes. So yun lang po ang expectation. Dapat alam po lahat ng ating mga kababayan. At marami pa hong mga kababayan natin, sa tingin ko, hindi pa rin nila alam, lahat na po ngayon ng uuwi, kailangan ng 72 hours pre-departure testing. So kailangan nyo po yan, pagdating nyo dito, wala na po tayong on-site or on-arrival testing. 5th day testing na kung fully vaccinated, 7th day testing kung hindi bakunado. So have your tests ready before you get home.
Thank you, Yusek. from Giselle Trazo po. For her question po, ilang bansa po ang may kumpirmado ng cases ng Omicron variant at ano-ano po ito? Base sa ilang BNO News, 29 countries na ito.
Yes, Giselle, no, we already have 35 countries in our list based on December 3, 2021. We will be posting this in our Viber group so that you can get the list.
Thank you po, Yusek. We'll just send that to our media partners group. From Catherine Gonzalez po of Philippine Daily Inquirer, can you confirm po that the 3 expatriates and ROF from South Africa who were quarantined in Negros Occidental already tested negative in their recent RT-PCR test po?
As of now, the results of their recent RT-PCR test is still pending. They are currently undergoing home quarantine.
Maraming salamat. We'll now be moving on po to some of our Zoom chat questions submitted by our media. For the first question po, it will come from Red Mendoza of the Manila Times. For his first question, with the discovery of the Omicron variant in a pop culture convention in the United States, ano po ang inyong advice sa mga mag-o-organize ng mga ganitong mga events to prevent a possible breakout of COVID cases, especially that a pop culture convention organizer is slated to hold an event at the end of the year po?
Oh, well, Red, meron naman tayong mga protocols, di ba, based on our alert level system. Yung mga protocols na yan, recommended yan by experts, pinag-aralan na magkakaroon ng assurance of protection para sa ating mga kababayan kung susundin natin itong mga protocols at capacity na sinasabi dito sa mga binigay na guidelines na ito. So if ever because of this Omicron variant, no, kung sakasakali, malaman na natin yung characteristic at saka po tayo magkakaroon ng revision. But for now, we think our protocols have that, we can be confident in our protocols as long as it's going to be complied with properly. Na andyan ang ventilation sa ating mga places or spaces, wala sanang crowding or mass gathering, bawal po yan at lahat po dapat bakunado at saka nakamask at saka may physical distancing. So if all of this will be complied with, I think the safety is there. But then again, let me just reiterate, pag lumabas na po yung further studies on this Omicron on how transmissible it is, dyan po tayo magkakaroon uli ng usapan with our experts in IATF on how we can further revise our guidelines.
Maraming salamat po, Yusek. From the next question, it will come from AC Nichols po of CNN Philippines. Her question po, with COVID cases significantly down, more people are vaccinated, booster shots are available, and everyone seems to be up and about, many companies are considering holding in-person office Christmas parties this year, saying it is much safer to hold in-person gatherings now compared to last year. Your thoughts po on this? For those who insist on holding in-person office Christmas parties, they should at the very least be very cautious. What should they keep in mind po when organizing or perhaps attending in-person holiday parties po?
Oh, well, I have this advice to all employers, no? First, hindi pa ho nawawala yung virus, nandito pa rin. Bagamat bumababa po at bumababa ang ating mga kaso dito sa ating bansa, kailangan natin isipin na naandyan pa rin po yung COVID-19 virus at maaari pa rin po tayong ma-infect o makapag-infect ng mga tao. Sa ating mga employers, kung sakasakali po, best pa rin to hold virtual parties, no? For this Christmas. Alam ko po, pangalawang Pasko na po ito na atin pong nagkakaroon ng difference, no? Ang ating pagse-celebrate ng ating Pasko. Pero sana po we can do this kind of sacrifices so that we can be able to prevent further infections in the community, in our population. Ngayon, kung talagang kailangan talaga at gusto nating ipatupad o magkaroon ng ganitong celebrations, I advise our employers to require that only fully vaccinated will attend the parties, that you will be holding this in an open space, and that everybody will be wearing their face mask and practice physical distancing. And please do not serve buffet dishes, no? So we can have plated dishes na lang po so that there won't be congregation in the buffet when you get food sa buffet table, and also of course sharing of food. So ito po yung mga usual na safety protocols na atin pong pinapaalala at sana po masunod natin ito para hindi na po tayo pagmulan ng mga impeksyon sa ating komunidad.
Thank you, Yusek. From Pia Regalado po, may statement po ba ang DOH sa kumakalat na info na hindi nasusunod ang 6-month interval for booster shots? May mga nagsasabi po na sa iba
Jolo, nag-gap ka. I did not get the question.
Sec, apologies po, Sec, may internet her question po, may statement po ba ang DOH sa kumakalat na info na hindi nasusunod ang 6-month interval for booster shots? May mga nagsasabi po na sa ibang vaccines kahit at least 3 months since second known po kung anong specific vaccine brand.
Yes, Pia, no? So unang-una gusto natin magpaalala sa ating mga vaccination sites. Pag tinignan ho natin yung Emergency Use Authority at saka yung guidelines na nilabas ng Department of Health, very clear na nakalagay dyan. Iyan po ang kauna-unang kondisyon na kailangan po nating sundin para po makapag-booster tayo. Na dapat po, tapos na kayo, you have this 6 months gap from your second dose already. So para po dun sa mga vaccination sites and local governments who are violating this protocol, ito po ay dapat itigil dahil hindi po natin alam, maaari magkaroon ng ibang reaksyon sa katawan ng ating mga kababayan dahil ibinibigay natin outside of the instructions or the guidelines given through the Emergency Use Authority of the Food and Drug Administration.
Mendoza po, the Manila Time, confident of reaching 17 vaccinated target population by we have allowed boosters for all. Repeat ko lang po yung question.
Let's go ahead, Red.
The extent of reaching the 70 million.
Yusek, apologies. I'll just
Yes,
read
go
the
ahead.
question po. From Red Mendoza, the question is the DOH still confident of reaching 70 million vaccinated target population by year end now that we have allowed booster doses for all adults?
Okay, so ngayon po ang ating target, no? It's 70% of the 70% target. So the 70% of the 70% target is 54 million individuals or Filipinos. So almost ngayon po, almost 37 million na ang fully vaccinated natin, no? So we only need about 17 million and we can already be able to vaccinate or to reach the targeted 54 million. So hopefully we get to reach that, what with the national vaccination days that we are doing, and hindi po natin dapat ikabahala na mase-set aside ang primary vaccination because we have opened up our doors to this booster dosing dahil meron po tayong separate na ginagawa para po dito sa primary series natin as against with these booster doses. Pinapaalala rin po natin sa ating local government, sa ating mga vaccination sites, ang priority po natin mabakunahan ang hindi pa bakunado. Ito pong mga booster doses ibibigay po natin kapag nakita natin na sufficient pa ang ating mga doses at saka ang ating mga logistics para po dito sa mga booster dosing. But our priorities would still be the unvaccinated and those to receive the second doses.
Maraming salamat po, Yusek. For the last question po from Jomel Garner of the Daily Tribune, makakaasa ba tayo na magtutuloy-tuloy ang pagbaba ng kaso sa kabila ng banta ng Omicron variant po?
Well, with the threat of the Omicron variant, we are not really certain. I will like to be very honest with all of you. Di po natin alam, no? Pero base po sa ngayong estado natin at base sa mga projections na meron tayo, patuloy pong bababa ang mga kaso hanggang December 30 here in the National Capital Region as well as the whole Philippines. Doon po sa projections natin, nilagyan po natin yung epekto ng bakuna, yung epekto ng pagtaas ng mobility, yung epekto ng pagbaba ng compliance ng minimum public health standards. So nakita sa projections na yan na mababago po na medyo tataas ang mga active cases natin kung sakaling tataas ng husto ang mobility at yung compliance sa ating mga standards for safety ay bababa, ngunit hindi pa rin po siya lalakpas, no, doon sa sinasabi nating threshold na talagang makikita natin na lalakpas na for this 7, no, na ADAR per 100,000 population dito sa ating bansa. So ang projection, patuloy na bababa ang mga kaso until the end of the year. Pero kailangan, pinapaalala natin, patuloy pa rin mag-comply sa minimum public health standards at saka magpabakuna na tayo para masustain po natin itong ating mga nagagawang pagbaba ng kaso sa ating bansa.
Maraming salamat po, Yusek, and that is all the questions that we can accommodate for today po. So before we close our media forum, Yusek, do you have any final message po for our kababayan?
Yes, bago po matapos ang ating media forum ngayong Biyernes, nais po namin uli kayong pasalamatan sa patuloy niyo pong pagtulong at pagsuporta sa Department of Health para po magpakalap ng tamang impormasyon. Gusto rin po namin magpasalamat sa inyo dahil alam po namin, katulong po namin kayo during the National Vaccination Days na nakapagbigay po ng suporta para maipakalap ang tamang impormasyon at saka yung mga success stories natin across the country. We would like to also congratulate all of our volunteers, our local governments, our vaccination sites, lahat po ng ating private sector partners, development partners, non-government organizations, lahat po ng tumulong sa ating National Vaccination Days. It was successful. We saw how Filipinos really wanted to get their vaccines. Ulitin po natin uli ito sa December 15 to 17 at sana po yun na ipakita nating commitment, yun na ipakita nating interest at yun na ipakita ho nating volunteerism at bayanihan ay maipakita natin muli sa December 15 to 17. Sa pagtatapos po ng linggong ito, mariin po naming pinapaalala galing sa Kagawaran ng Kalusugan ang mga sumusunod. Sa kabila po ng patuloy na pagbaba ng ating mga kaso sa bansa, atin pong tatandaan, hindi pa rin po tapos ang ating laban. Naandito pa rin po ang COVID-19 virus. Tayo po ay umiwas sa mga 3Cs na lugar, closed spaces na walang maayos na daluyan ng hangin, closed contact settings na nagkakaroon po kayo ng close interactions mula sa ibang tao, at clustering kung saan hindi nasusunod ang physical distancing. Ang pag-iwas po sa mga lugar na ito ay makakabawas sa posibilidad na mahawaan kayo ng virus o makapanghawa kayo ng virus. Bagamat bakunado na po tayo, huwag po nating kakalimutan ang pagsunod sa minimum public health standards. Kailangan pa rin po nating pag-igtingin ang pag-iingat upang masiguro ang kaligtasan nyo, lalo na po ang kaligtasan ng ating mga inuuwian sa ating tahanan. Ang mga edad 11 pababa ay nananatiling vulnerable sa COVID-19, kaya labis po dapat ang pag-iingat at disiplina at dapat lagi po nating isa puso at isa isip na maprotektahan po natin ang ating mga anak at ang ating mga pamilya. Tuloy-tuloy pa rin po ang pagpababakuna at patuloy pa rin pong nananawagan ng Kagawaran ng Kalusugan na magpabakuna na po tayo lahat laban sa COVID-19. Maraming salamat po. Happy weekend and we will see you on Monday. Thank you, Jolo.
Maraming salamat po, Yusek. Maraming salamat to our media partners. See you on Friday and stay safe po. I see you on Monday. Stay safe po.